People experiencing homelessness had terrible treatment in the hospital many years ago. We really didn't know what to do. Everyone wanted to do more, but we just didn't know the best practice for it.
Yeah, so it was one of the periods when I was living on the streets. 8 o'clock appointment at the local doctor's. Day centres don't open till 9, so I ended up having to go in what I'd been sleeping in.
Stigma and discrimination is rife among healthcare professionals towards people experiencing homelessness, and I hope that the guidance will help challenge healthcare professionals' own beliefs when we are treating people experiencing homelessness. I know that certainly was the case for me.
You know, doctors, they're always running late, so sat in the surgery, a couple of other people in there waiting for their appointments, and I saw somebody get up and go and talk to the receptionist. Next thing I know, the receptionist coming out, opening all the windows in there, and then she pulls out this can of air freshener and starts spraying it all over me.
My personal experience facing that despair of homelessness, I felt very isolated and pushed out and very much judged, that I was less than.
Ended up in typical me style, effing and blinding at her, and walked out.
With the advent of these NICE Guidelines, which have been developed by experts from all over the country, developing the best standards of care, we finally have an evidence-based resource which we can all refer to. Every speciality, every nurse, every doctor, anybody can refer to these guidelines and use them to the advantage of the staff as well as the poor people experiencing homelessness.
Well, I'm absolutely delighted that there is a guideline on healthcare for people experiencing homelessness, because this is exactly what we need to design services for people experiencing homelessness and to learn from other people's experience. It's a very well produced guideline. It covers absolutely everything that a commissioner of these services really needs to know.
And following this guidance, we now have a model, we have processes and we have support in place. We have a designated worker for the emergency department who will support people into accommodation when they leave A&E. And we're also able to offer more holistic and patient-centred support, which we weren't in a position to do before.
That feeling of being judged and not part of society, and my self-worth and mental health being driven by my addiction and that, almost pushed me out the door, you know.
In the 10 years we've been looking at this, so before and after NICE Guidelines, you know, we've just seen a dramatic shift in care, in patient morale, in staff morale.
I have already sent an email to our commissioners from this service to say, look, this is really worth reading. It covers everything, every point you need to properly design and commission and provide a service for people experiencing homelessness.